Hey y'all, welcome to my channel. It's your girl Lanecia, but you can call me Neci. Today we are back with a video on tips for nursing school. If y'all don't know, I am a registered nurse. I've been a RN for 5 years now. I was an LPN for a year and a half prior and a CNA before that. I have worked on pretty much med surg, telemetry. However, I have pretty much like worked all over surgical units, renal units, things of that sort. It's kind of like that fall in the med surg category, but not really be med surg. I also did a contract at the Shepherd Center. I worked on an ABI unit, which was pretty much craniotomies and stroke patients, TBIs, and things of that sort. So I pretty much have a good experience of nursing. Even did a contract on a step down unit, which was pulmonary cardiac step down. Since becoming a nurse, I did 9 months as a new grad on my med surg floor. And after my 9 months of working, I traveled and I've been doing contracts ever since. So yes, that's just a little backstory about me. So I'm going to give you all tips for nursing schools and tips for the ones that want to get into nursing and wondering like, should I not? My thing is, you cannot do it just for the money, because to me, sometimes the money not even worth everything that we do. Like, we go to school for all them years, and as a nurse, we have so many roles to put on. Just basically, we have to put on the roles as a dietitian. We have to deal with all the providers. We have to deal with family. We are like the frontline workers. Like, we are the person that everybody come to. Like, you have to wear so many freaking hats as a nurse. Just doing it for the money, for the aesthetic, is just like not given at this point of time. Like, you have to have a passion for it. And no, I do not have no family members, no nothing. Like, and when I look back, people are like, why did you become a nurse? I don't know. It was always a calling for me. As a little girl, I got prophesied on, and then I just knew my journey. Like, I think I was like maybe in middle school or high school. I want to say middle school. I got prophesied on early on that was my calling, and that was the route that I took. And it always has been a passion, even though it's very tiresome at times, and it's just overwhelming at times, but I love what I do. So anyways, back to the video. We are giving tips for nursing school, tips for those who's trying to get into nursing school. And long story short, y'all, growing up, I always wanted to be either a teacher or a nurse. So here I am. I'm a nurse. I have 1 more semester left, and I will be a nurse practitioner. We're gonna get in that another day, another time on my journey of that, because it has been a while. But anyways, damn, and I feel like one day in life I am going to teach nursing students or nursing school. That's like my ultimate goal. Like, when I'm just tired of bedside, which is now. So yeah, just got a list of things jotted down concerning tips for nursing school. And the crazy thing is, I wrote this down like so long ago, and it's just been in my planner on me making a video of it. So now I finally got the time, and now I finally, I'm not gonna say finally, but I am trying to be more disciplined and actually do the things that I want to do. Here I am trying to be consistent. So if you're seeing this video, I guess this is the sign for you to be consistent too in the things that you want to like. My biggest tip is to take a lot of practice questions and read the rationales. During school, I thought this was like trying to memorize, because not trying to brag or boast, but I never had to study. Like, I can look over my content or the concept the day before or the day of the test and get by with a passing grade. So nursing school was a big challenge for me. So coming from me, like dummy 101, you do want to do practice questions, like on the topic that y'all studying. Do a lot of practice questions. Read the rationales. So learn how to study. Like I said, I struggled. After I failed, I used to go in my mom's kitchen and literally read. That's not going to help. That's not going to work, honey. That's not going to work. Flashcards, the teach back method, that was the thing that I love the most. Is the teach back method, because I guess I wanted to be a teacher, so that helped me learn and even relating things to certain things. Like low estrogen causes an increased risk of osteoporosis. And I just kind of tied that in, even though my mama don't have osteoporosis, but she do be complaining of her bones aching and stuff like that, and taking vitamin D and things like that. So I kind of correlated it, so I will never forget osteoporosis, low estrogen. My mama, even though my mama ain't got it, but you know, you kind of relate. If you can find something to relate it to, that would be like chef kiss, like, and even like the mnemonics, like those are my favorite. Even now to this day, I remember a whole bunch of mnemonics. Like the treatment for MIs is Mona, morphine, oxygen, nitroglycerin, aspirin, like. And then the telemetry, how to put your tele leads on a patient, it is whites on right, clouds over grass, smoke over fire, and then the brown goes in the middle, of course. You just got to find ways to help you remember and help you learn catchy things. I'm a big picture lady. Even writing things down, I can remember, like, that's why I had this on this side of the paper. This what it said. Like, that's how I remember. So you just got to find your learning technique. Study groups, Quizlet, writing things down and color coding it. You just find your techniques. A big pro tip for nursing students, or the ones that want to be nurses, is CNA school. Or just getting your CNA, working as a CNA, working as a patient tech. You know what a Foley is. You know how to care for it. You know what a drain is. You know how to care for it. You know, like, you know how to properly enroll a patient. You know how to properly doing it. I feel like CNAs always have an advantage on the brand new people that's just not, they don't know anything about the medical field. They're completely new. So working as a patient tech it's a big advantage, especially in nursing school. YouTube, I know like Nurse Sarah, she has a lot of YouTube videos on how to do certain skills. So you can also do that. That is very beneficial. And stay organized, y'all. Stay organized. Get your little planner, jot down the things, the deadlines, things you need to accomplish, and try to accomplish it days before, because look at me. I'm here talking when I could have been about to graduate in May because of my procrastination. That was just pissing me off. And the last thing is, y'all, if you fail, it's okay. I failed, and here I am 5 years later, about to graduate. Okay, do not beat yourself up about it. I know sometimes we be discouraged, but try again. It's okay. Because guess what, girls? God is within you. You and I fail. Favorite tat. This is my favorite tat. I got it tatted on me my first semester after failing nursing school. Like, that was prophesied to me. That's in God's will. Like, that's what God wants for me. So even though I failed not one, not two times, I failed a couple of times, I always got back up again. And that's what I want y'all to do. Stay encouraged. And yeah, let me know if it's another video that y'all would like to see. I will be happy to come on here and chat. But my thing is, y'all, even if you're young, like in your, let's say 16, that's the time to start working. I highly recommend a 16-year-old that future is to become a nurse, anything in the medical field, to start out with a job that caters to the people. Customer service. When people come to the hospital, yes, they're sick and they need people to cater to their needs. Your attitude, your persona, it speaks volume. Learn how to care for people, because some of these nurses got life messed up. And I'm like, you have zero customer service. Like, I always have patients just thanking me and like, you're so sweet. I don't know if it's just Mississippi hospitality or what, but some stuff just be common sense. So I hope this helped, and yeah, see you guys in the next video. Bye.